Thank you very much indeed, Dr. Anne Van Laue. Good afternoon, family and friends of Rotary and guests. We now call this meeting to order. I will now play for you the Kenya National Anthem. Kindly give me a moment. Thank you very much indeed. And now we will have a prayer. Let us pray. O God and giver of all good, we thank Thee for our daily food. May Rotary friends at Rotary Ways help us to serve Thee all our days. Amen. I would like now to take this opportunity to introduce to you our wonderful chair for this Cancer Awareness Initiative, Dr. Anne Van Laue. Dr. Anne Van Laue is the president of Rotary Club of Nairobi and has also served as past assistant governor. Has held several district positions in the many years and continues to do so. This year, as well as last year, but this year she continues to hold the designation as the Cancer Awareness Chair on behalf of the district, 9212, and has championed many cancer awareness initiatives last year and continues to do so this year. Dr. Anne Van Laue is a recipient of honorary doctorate due to the incredible amount of humanitarian work which she carries out, for which she has been recognized internationally. She's also chair lady of the Nigerian Women in Kenya and founder and CEO of an NGO. Dr. Anne Van Laue, I welcome you to kindly initiate and address the participants and attendees of this wonderful meeting. Dr. Anne Van Laue.
Thank you very much, President Ritesh. Welcome, family and friends of Rotary on behalf of District 9212. I welcome you to this very important day and event where we will be sharing life experiences and valuable clinical information about cancer. And cancer awareness. I am the Rotary Cancer Awareness Chair position which I am now serving for the second term. Today we have organized for you to benefit from a very educational talk and panel discussion. The speakers include leading oncologists, cancer specialists, health advocates, as well as cancer warriors. Please do learn and share this information and learning. President Ritesh.
Thank you very much indeed, Dr. Anvan Lawe. And I now request our district secretary of District 9212, which comprises of Kenya, Ethiopia, Eritrea, and South Sudan. The district secretary is Rotarian Tito Tadeo, who is with us here today, and we are honored to have his presence with us. District Secretary Tito, could you kindly address the attendees?
All right. Thank you very much, President Ritesh. And I would like to sincerely thank the organizers of this webinar, President Amb Dr. Rotarian Benda Kithaka, Rotarian Kamal Sanghani, and all who have put together this event. And also from District 9212, I also want to welcome all of you to this webinar. And I would also want to pass my condolences to our DG Patikopat and his family for the loss of his sister, who has been ailing from osteosarcoma, that's the bone cancer. And she'll be buried tomorrow, and I wish him well, and I'll be holding brief for him in this session today. And cancer is a national public health concern, and it actually accounts for 9% of all the deaths in 2017, representing a growth of 41% between 2010 and 2017. And it's been ranked third amongst the leading cause of death. And according to the Global Cancer Observatory in 2018, breast, cervical, and esophageal are the leading cancer affecting women. And they affect 20.9%, 18.3%, and 7.3% of the women population, respectively. Then esophageal, prostate, and colorectal cancers are the most common cancers amongst men, with rates of 14%, 12%, and 5.9%. And amongst children, we have the retinoblastoma, nephroblastoma, and Burkitt lymphoma. And they are cited as some of the common cancers amongst children. And the risk of developing cancer before the age of 75 is 18%, while the risk of dying from cancer before the age of 75 is 14%. We as Rotary, we must respond in tandem to the challenge in Kenya. And we need to grow the awareness efforts from one club to cluster of clubs, to regions, to a country, and to the wider Rotary community. And we need to invest in online facilities that draw in more clubs, including clubs in other countries, within the district, in Ethiopia and Southern Sudan. We also need to draw in some of the national players in this space. That is the National Institute for Cancer, the Ministry of Health Program in Cancer, KEMRI, the county referral hospitals, as well as the private sector hospitals like Pisha. We also need to develop partnerships with a number of agencies and groups like KEPSA, and philanthropies like the Beth Mugo Foundation, the Nyong'o Family Africa Foundation for Cancer, and the Dr. Manu Chandari Foundation. As I sit here today and engage with our speakers together with all of you, I believe that we'll be able to enrich our awareness, our knowledge, and also our response to cancer. And I would like to wish you all well, and we shall be in touch with the district programs chair, who is on this call, Past President Janet Masharia, and also the country health focal point, Rotarian Josephine Ojiambo, for the updates. Thank you very much, President Ritesh.
Thank you very much indeed, District Secretary Tito. We are truly grateful and honored with your presence today. And whilst we wait for the moderator for today to join us, I'm going to take this opportunity to introduce the speakers, the panelists for today. Is that all right? Dr. Anvan Lawe? Right, so we will go into the program for today. As we proceed, we will have our panelist moderator with us. The panelists for today, I'd like to introduce them at one go, and thereafter we will begin the panel discussion. The first panelist we have is Dr. Mariusz Marek Ostrowski, MD, PhD. who is a consultant oncoplastic breast surgeon at MP Shah Hospital and Village Medical Center in Nairobi, Kenya. He has worked as a consultant breast surgeon in the United Kingdom and Poland for over 10 years. Dr. Ostrowski has conducted research on oxidative stress and received a research scholarship from Nagoya University School of Medicine in Japan, which led to his PhD in medical sciences, antioxidants in the process of apoptosis in cancer cells. He's a fellow of the Working Group of Breast Surgery, European Board of Surgery, FEBS, member of Association of Breast Surgery, and the American Association of Breast Surgeons. Our next panelist is going to be Dr. Sudesh Walia. Dr. Sudesh Walia is an Ayurveda specialist. Dr. Sudesh will be telling us what Ayurveda is and how magical Ayurveda can be in the treatment of several ailments. Dr. Sudesh is a Rotarian who truly believes in service above self and has held many leadership positions in Rotary District 9200 and 9212. She has represented our Rotary District in the USA twice. Dr. Sudesh has been the second lady member and the president of Rotary Club of Nairobi in 2003-2004, and the first lady country chair. We then have Dr. Robert Kimutai. Dr. Robert Kimutai is a pediatric hematologist working at KEMRI. He trained for bachelor's and master's degree at University of Nairobi. He also has a master's in public health. He is certified pediatric hematology oncologist from Makerere University in Uganda. Previously, he has worked in infectious disease research, HIV, malaria. He is currently developing research in blood diseases and cancer at KEMRI and has other research-related roles too. He is attached to the Kenyatta National Hospital Pediatric Hematology Oncology Unit. Thereafter, we have Dr. Alfred Karagu. Dr. Alfred Karagu is a public health specialist with over 12 years experience in clinical care, health services management, monitoring and evaluation, training, and public health research. A holder of a bachelor's degree in medicine and surgery and a master of science in health systems management, and is a graduate of the CDC-supported field epidemiology and laboratory training program. He has a vast experience in program management in both infectious and non-communicable disease prevention spheres, having worked in the public health sector across the national and county government levels. We thereafter have Benda Kithaka. Benda Kithaka is a Rotarian, founder of Kilele Challenge, a movement that is helping others find life purpose. She is also a world-renowned health advocate by day, a published author, and a closet creative goofy writer by night. She thrives in storytelling and inspires others to live their best life now. Benda received her Bachelor's of Art degree in Politics and Government from the University of Nairobi and her postgraduate diploma in leading high-performance health organizations from Strathmore University. In between, she has also amassed many certificates and awards in advocacy, published in a number of peer-reviewed journals, and written numerous op-eds for local and international publications. We also have with us today Cindy Ogana. Cindy is a creative journalist who has over 10 years experience in live and online content management, communications, and media relations. She has studied creative arts at Moi University, worked as a radio presenter, TV producer, social commentator on television. Her passions for development has led her to pursue a career in fundraising and communications manager at Faraja Cancer Support Trust. It is here that Cindy has honed her skills in communication and resource management, event and program management, donor relations, report writing, editing, and proposal writing. Thereafter, we have Carol Mudhoni. Mudhoni is an epidemiologist and has worked over a decade working with global institutions to support disease management in the East African region and globally. She is a Rotarian, a humanitarian institution with a mission of service above self. Muthoni is a person living with cancer, and her experience crystallized the realities of a lack of reliable information, under-resources and fragmented healthcare system on the outcomes of cancer diagnosis. Muthoni has also refined her own worldview and reaffirmed her contribution in the battle against all types of cancer, which lead to an establishment of Cancer Cafe, an innovative non-profit making organization that is tailor-made and has solutions for people living with cancer and about cancer prevention and management. We have with us Joyce Shamshuddin, who's a Rotarian, a cancer survivor, a warrior, has also got vast experience in the business profession with VetCare, an organization of which she's a director, and past president of Rotary Club of Nairobi, Utumishi. And we also have with us a cancer warrior charity, whom I'd like Dr. Anne Van Lauwe to kindly introduce. Dr. Anne? Dr. Anne Van Lauwe?
President Ritesh, I think she's offline for a while.
Welcome, past District Secretary Kamal.
Hi.
I'd like to take this opportunity to introduce our past District Secretary Kamal Sanghani, who is the moderator for this very important event today.
Good afternoon, everybody. Can you hear me? Yes. Can I invite Dr. Marek Ostrowski? No. Can Dr. Mariusz?
Yes, hello, good afternoon.
Hello,
everyone.
good afternoon, how are you? Dr. Mariusz is the consultant oncologist, breast surgeon at the MP Shah Hospital and the Village Medical Center, which is situated. Mary Muriki, can you mute your mic, please? Mary Muriki. Thank you. Dr. Ostrowski is the consultant oncologist, breast surgeon at MP Shah Hospital at the Village Medical Center in Nairobi, Kenya. He has worked as a consultant breast surgeon in the United Kingdom and Poland for over 10 years. Dr. Ostrowski has conducted research on oxidative stress and received a research scholarship from Nagoya University School of Medicine in Japan, which led to his PhD in medical science, antioxidants in the process of apoptosis in cancer cells. He's a fellow of the Working Group of Breast Surgery European Board of Surgery FEBS, that is specializing in breast, member of the Association of Breast Surgery in the UK, ESSO, USOMA, and the American Society of Breast Surgeons. Dr. Ostrowski graduated from the Medical University of Gdańsk in Poland in 1995 and thereafter trained in general surgery, receiving the certificate of completion of training in 2008. Subsequently, he undertook subspecialty training in breast cancer, oncoplastic, reconstructive surgery, and surgical oncology. In 2012, he obtained the European Board of Surgery EBS qualification in breast surgery. Welcome, Dr. Ostrowski. Welcome to our talk on our Cancer Week.
Thank you very much indeed.
Dr. Ostrowski,
the Rotarian, the President.
You hold a lot of wealth, knowledge in oncology, especially in the breast cancer. My first question to you, Dr. Ostrowski, is what are the side effects of chemotherapy?
First of all, thank you very much for having me here today. Dear colleagues, dear Rotarians, Mr. President, thank you very much. Now, chemotherapy is one of the treatments which we can use in breast, or let's say in any cancers. But before I talk about chemotherapy, I think I would like to send a message. I can see many faces I know, so we probably met before, we discussed different issues before, but chemotherapy is one of the treatments which we offer to treat cancer patients. Now, chemotherapy, yes, it's very important, and with different cancers, it could be the most important treatment, but at the same time, the message which I would like to send here today is that very often, and especially with breast cancer, and this is October, it's October Breast Cancer Awareness Month, we can, if we detect cancer early, we can cure the cancer, we can cure the problem, we can deal with it completely very often without using chemotherapy. Now, your question is very important, but the answer is not easy. What are the side effects of chemotherapy? There are many different side effects of chemotherapy because there are many different chemotherapy treatments. And usually when we watch movies or when what we hear from the news is that usually the side effects could be someone is very weak, someone is very, very tired, someone's immune system is very low because chemotherapy kills the fast-developing, fast-growing cells, and this includes our immune system and our blood. So this means that this particular person undergoing chemotherapy will be weaker, will be much weaker and much easier to catch any infections. It may be nausea, it may be vomiting, diarrhea, and so on. So there are many different side effects, but at the same time, I think it's very important to stress here that when I see my patients, and many of my patients are breast cancer patients, when I see my patients after they complete chemotherapy, they say, you know what, I expected something worse. Yes, it wasn't easy. Yes, it is tough, but I expected worse. Quite often, and it's especially, I think, difficult for ladies, is that after chemotherapy, there could be hair loss, but every chemotherapy is different, and there could be some different side effects, and every one of us, or every patient reacts in a slightly different way. So yes, chemotherapy will have some side effects. There could be different, even the same chemotherapy may have different side effects for different patients, but because there are different cancers and different chemotherapy, on top of everything, there will be different side effects. Usually related to the person being weaker, the immune system being weaker.
Thank you, Dr. Ostrowski. That's very eye-opening. Yes, well, I'll take you on a lighter note that even when you get married, there are a lot of side effects. Also, tell me, Dr. Ostrowski, what are the early symptoms of breast cancer?
This is a very good question. Thank you very much. It is very important for ladies and for gentlemen to know their breasts. I'm talking about ladies and gentlemen, meaning their partners, but I'm also talking about gentlemen because men can get cancer as well, can get breast cancer. Most important is to know your normal, know what's normal for you. So I usually give some homework to my patients when I talk to them and when they ask me, okay, so what should I look for? Norm means, and everybody's different because some breasts are small, some breasts are big, some breasts, one could be bigger, one could be smaller. And that's why the norm for you is most important. Now, breast cancer, and this is my message to take home, cancers usually come without any pain. Please don't wait for pain. Cancers may cause pain, but usually if it happens, it's very late. This means that it's a big lump, big lesion, which is invading muscles or invading some other structures, invading nerves. Cancers usually come without pain, so please don't wait for pain. Now, looking at breast. Breast is a sac made out of skin. Inside the sac, there is a bit of breast tissue, up to 27 breast lumps, let's say lobules, and a bit of fatty tissue. Now, skin is window. Skin can show us that there is something going wrong inside the breast, deeper in the breast tissue. So any changes within the skin, and this could be spots, you know, like little spot. This could be an area which is slightly reddish, which looks like a mosquito bite, but which doesn't go away. This could be some sore. This could be a dimple in the skin. This could be skin which looks a bit thicker, looks a bit different, or skin which looks like the orange peel, like orange skin. Skin very often shows us symptoms of breast cancer. So anything what is not normal, what wasn't there a month ago, and it doesn't go away within a week or two, it should be investigated. Then when we look at the breast, there is nipple. Usually every breast, unless there was surgery, there is nipple. And nipple could be another window to show us that there is something going inside the breast tissue. Nipple could be pulled in, we call it inverted nipple. Nipple could be leaking. There could be bloody discharge or watery discharge, usually from one nipple, usually from one duct. The nipple could look a bit crusty, different. So nipple could show us that there is something going wrong. Now, of course, usually when we talk about breast cancer, usually we talk about lumps. Yes, many patients, and it's many ladies and men, usually come with a lump, usually come with different shape, different size of breast, something what happened within the last few weeks or a couple of months. Basically, anything new, anything different within the breast tissue, what is not normal, could be potentially breast cancer symptom. Please do not wait for pain. Many cancers come without pain, and I know patients, and I met some patients here in Kenya with big lumps. There was one lady, one patient I know, who had 2 big lumps in her breast, but no pain, so she was waiting for pain. But this was cancer. The cancer spread already to other parts, to other organs. Just to finish, any change in the breast, any change in the skin, it may look like a mosquito bite, and if it doesn't go away for a couple of weeks, it needs to be investigated because it could be potentially cancer.
Thank you, Dr. Ostrowski. Just before you go, in 1 minute, can you explain to me, is it the breast cancer research or should I say a fully fledged hospital like MP Shah, can we come there and get ourselves checked up, and if surgery is needed, do you do surgeries? Just in 1 minute.
Yes, at MP Shah we have one-stop clinic. I came to Kenya a year ago and I met some of you. I can see a few faces we met already. I came to Kenya a year ago to set up one-stop clinic. We have a breast unit. We have a European British style breast unit. Any problems, any of those symptoms which I mentioned, please see your doctor or come to the breast clinic. We have one-stop breast clinic at the MP Shah main hospital in Parklands. And I'm there in that clinic every Monday and Wednesday, and every Thursday and Friday at MP Shah Village Market. And yes, usually, in most of the cases, one-stop clinic means we discuss the problem, we investigate, and the investigation usually means mammogram and ultrasound scan or ultrasound scan. And by the end of the day, so let's say it shouldn't take longer than 2-3 hours, the person who comes to see me will be able to go home knowing everything is fine, or there is something we need to investigate further. Very often, I can even do the biopsy if needed on the day. And yes, indeed, of course, I'm a breast surgeon. I'm an oncoplastic breast surgeon. So offering full spec of breast cancer surgery or any breast problem surgery. And this includes mastectomy with reconstruction. But most important is, and this is again message to take home, is that with many cancers, and many 75 to 80% of my patients in the UK had breast conservation, which means we can remove the cancer, we can cure the cancer and keep the breast. And this is my aim. My aim here is to detect it early, to be able to cure it, and to be able to offer surgery to remove the lump, to remove the cancer and keep the breast. Thank you.
Thank you, Dr. Ostrowski. You've been a great speaker. We've learned a lot from you, and thank you very much for working with Rotary Cancer Team. And we look forward to working with you in the future as well. And I will come and see you one of these days and have a coffee with you. And well, I believe in one thing. Medical illnesses come to you, but they go away at the same time with the help of doctors like you. And I believe that once in a while you need to take your car to the garage. So we need to bring our bodies to you so you can become the mechanic and check out our bodies. Thank you very much.
It's a teamwork. And
yes.
Thank
God
you
bless you.
for having me here today.
God bless you and have a good afternoon. God bless you.
Thank you very much.
Thank you. Now I'd like to call upon Dr. Robert Kimutai. Dr. Robert Kimutai, are you there?
Yes, I am here.
Dr. Kimutai, yamune.
Achamage, Kamal.
Mamingala, missing. Yes, you see, we Rotarians, we cross borders. We do not just stay in one square. So when we help people, we learn their language, we learn their ways of life, and we become part of them. Welcome. You are a pediatric oncologist here in Nairobi. It's nice to see you. Nice to host you today. Dr. Kimutai, from what age can we get cancer?
Okay, thank you very much, Kamal. For cancer in children, there's really no kind of age. All kind of ages can be affected. Remarkably, even babies in the mom's womb whom have been diagnosed with masses maybe through ultrasound have later on been confirmed to be cancers. So we actually see cancers in the whole pediatric age group. What we kind of see is there are kind of patterns. There are patterns where you see the young children who have cancers. Then we have this age group which is shared between adults and us, whom we call adolescents and the young adults. Then now we have the adults on the other end. So the range of pediatric childhood cancers is wide. In younger children, you mostly may see things like, or let's say infants and children, you may see things affecting the kidney, like what District Secretary Tito had mentioned, things like the eye, and this are kind of usually related to the development of the child from the time they are in the womb of the mother up to the time that they're about, let's say, 1 year, 2 years or so. When we move towards the toddlers, who are, let's say, the young children, we see things like the leukemias and the lymphomas. And then when you go towards the older children, we tend to see the bone and soft tissue sarcomas, soft tissue cancers. So in general, we can see cancer from all age groups. It is less common in the very, very young, but becomes much more common as a child moves towards 2 years going onward. Thank you. Over. Oh, sorry, I can't hear.
Dr. thank you very much for that. You know, when we go to the doctors and we are told under unforbidden circumstances that you've got this illness or you've got that illness, sometimes we're told you've got cancer. It is so shocking. It's sometimes you feel that the world has collapsed. The floor underneath you has just gone down 6 foot under. You've lost all your hope in life and everything. How do the parents cope when something like this is being told about their children?
Can you block all those windows, please?
Dr. we can't hear you.
Okay, sorry. Thank you for the question. I think the question was related to how the parents or families deal with a diagnosis of cancer, right? Now I can't hear you. Can everyone hear me?
I can hear you, Dr.
Yes, we can hear you.
Okay, I can't hear.
We can hear you.
Go ahead, Dr. Kimutai.
Okay, so what I was saying is that indeed a cancer diagnosis is a very frightening diagnosis. Yeah, cancer diagnosis is a very frightening diagnosis, and most parents who get a cancer diagnosis, I think the first question which runs in their mind is whether the child is going to live or die, because we have a lot of myths and negative connotations and perceptions about cancer. But to put this in perspective, I'd like to say that when you have cancer in the, let's say, the rich countries, the outcomes are really very, very good. We talk about more than 80% cure, and talk about even 90 to 95% for some specific type of cancers. So regarding this question, I don't even know where to start, where to end. But I think what we need to understand is that when we are treating a child with cancer, we are treating the entire family. There are unique needs to children, like children like to play, they go to school, they are living, I mean, they like visiting people, they like playing sports, and they're largely dependent on adults. Then this, because the cancer diagnosis is not clear where it comes from, it tends to strain families who are trying to think about where could this cancer have come from. The cancer diagnosis itself can be very emotionally straining, but besides being emotionally straining, there are also other things, other aspects in terms of diagnosis, in terms of treatment, in terms of follow-up, which end up draining the family financially. Spiritually as well, the family may be affected, and because there's a lot of questions which are asked. So in terms of affecting children, there are many other things. The family itself may come. We know the cancer centers are very few in the country. They tend to be in big towns. And so sometimes people have to travel very long distances, have long periods of separation between the families. The mother and the father, they kind of almost breaks up the family a bit. Then I think Dr. Marek had already mentioned about things to do with side effects. And once you start cancer treatment, you know that the body changes for the child. There's things like hair loss and things like new things which come into life, like procedure rooms, some other side effects. So you find overall, cancer can affect children and the family in a very, very big way. But whenever we start treatment for children, I think we always start by emphasizing that really in children, the cancer is really very different from adults. The cure rates are very good. The outcomes generally can be very good. And therefore, we put counseling as a first kind of thing that we need to do more than even anything else, so that when the parents are dealing with this, we have to deal with the situation, understanding that cancer outcomes are good. Of course, there are rare situations where from the beginning, the cancer diagnosis is kind of terminal, and that one we deal with it in a different way. So I think this has already been mentioned by Dr. Marek. It's a teamwork. We have the medical side, where we have the oncologist, radiologist, pathologist, we have the surgeons, we have pharmacists, nurses who deal with all these things. But even more importantly, the psychologists and social workers and all these teams which put together actually help in being able to make families cope, teaching them coping methods. And I think most important, if there's anything that we need to learn and pass on, is that we show that we genuinely care for the family. We develop long-lasting relationships with the patients, and we are there always to shoulder them or make these kind of overwhelming situations a little easier on the family, because it really can be a very tough thing to go through without any support. Thank you. Over.
Thank you very much, Benda Kithaka. Dr. Ari, thank you very much. My hat's off to you. We adults have a lot of difficulty in accepting sometimes what has happened to you. You are expressing that fears or your confirming something that the parents are dreading for their children, and you are a very strong man. I can assure you that much. And thank you very much for coming to our talk today. And we look forward to working with you in the future. And Kongoi Sana.
Kongoi, Dr. Kamal.
Now I'd like to call upon Dr. Alfred Karagu. Dr. Are you there? Dr. Karagu?
Yes, I am. Thank you.
Hi, Dr. Karagu. How are you, my friend?
I'm very well, thank you.
To Rotary Cancer Talk. It's nice to see you in person. Dr. what interventions has the Ministry of Health put in place to enhance cancer awareness and prevents among the general public? What has your ministry done?
Thank you for that question. And again, thank you for this opportunity for us to be able to engage with the Rotarian community. It's true that the ministry has been very, concerned about the growing cancer burden in the country. And in terms of the various interventions that we have put in place, I think we have addressed them from different levels, from the community level to the health facility level, all the way to the national level where we are based. So I think looking at the community level, there has been a very keen, a deliberate effort to engage or to take advantage of the community health strategy. I think the community health strategy is an initiative that has been going on within the health sector, whereby you have community health volunteers who are attached to various, to the primary healthcare facilities, especially dispensaries and health centers. So in the ongoing, push for universal healthcare, where community health volunteers have been involved in terms of awareness creation, we have, built their capacity. About early this year, I think, or late last year, just before COVID came in, there was a nationwide, country level, capacity building, targeting community health volunteers to empower them with information. So I think that's one level that we are taking advantage of. The other level is in terms of healthcare providers. So we are, using a cadre of healthcare providers we call health promotion officers, who are based at the county level or even at the health facility level, to educate members of the public, especially those who come to the health facilities. You'll find that in many settings, at the beginning of the day, when patients are coming in for service, there will be these health talks that are being provided, and there has been a deliberate effort to make sure that part of these health talks involves awareness around cancer prevention. Now, at the national level, I think what you have tried to do is to engage stakeholders so that we use different, platforms for awareness creation. I would say, for instance, in this, in the past, in the ongoing Breast Cancer Awareness Month, we have worked very closely with the civil society groups. We have worked very closely with the media to make sure that we have platforms, or we have opportunities to talk about cancer. So you probably may have heard myself or a number of people, on radio stations, on TV, talking about cancer. As the National Cancer Institute, we have done a round of visits to the counties, engaging with various counties to empower them with information. And I think the other maybe area that we are trying to engage in, and we have started the discussions, is how we can take advantage of the Huduma, centers across the country to also use them as platforms for creating awareness creation. So Benda
Karagu, yes, that you're making awareness to the people. I understand that. And you've gone to the last mile and to the grassroots. But, cancer is very expensive in this country to treat. What is your ministry doing to work in conjunction with the medical suppliers, with the hospitals, and what is your ministry doing to make this an affordable disease or illness?
I think the greatest hindrance has been availability of these services in the public sector. So I think one of the key things that the ministry has adopted is to ensure that these services are available in the public sector at places that are near to the ordinary folk. So I would talk about treatment services, for instance. We have seen a growth in terms of access to cancer treatment services for chemotherapy, for instance. Currently, we are talking about 11 county referral hospitals being able to provide, cancer treatment. I could talk about all the way from Mombasa to Garissa to, the various level 5 hospitals being able to provide, treatment services. The other modality, the other way that we have approached, or we are using to manage the care, is in the issue of medicines, because I think we realize that the cost of medication contributes heavily to the cost of cancer care. So through working with KEMSA, we have actually been availing we have been availing medicines to this county referral facility, so that it's much easier for members of the public to access medicine at these facilities. So that is in terms of treatment. Sorry, I think you're muted. I can't hear you. I can see you talking, but I can't hear you.
Is NHIF covering cancer? Like what
yes.
with renal care?
Yes. NHIF is covering cancer in terms of taking care of chemotherapy, taking care of radiotherapy, and now the ongoing discussions is how they can start taking care of things like screening, how they can start taking care of mammography, paying for mammography tests, paying for pathology tests. So I would say NHIF has played quite a big role in terms of bringing affordability, but there's room for improvement, because whereas they have done quite well in terms of treatment, I think where we are seeing a big gap is the issue of diagnosis, because we have not had NHIF cover some of the diagnostic tests, and that's a push now to make sure that NHIF is able to cover that.
The last question from me, and I want if you can answer in 1 minute, is that your ministry has invested heavily on renal care, and they've put in dialysis diagnosis in a lot of hospitals, and a lot of emphasis in advertisements have been given on renal care. What is the ministry's next step to bring out this cancer awareness? Is there anything in progress that we are going to see billboards, we're going to see hospitals advertising to say that cancer is available under NHIF?
Well, I would say that I wouldn't talk about maybe having billboards and and maybe major major adverts going around. I think what the ministry has adopted is to take advantage of the existing structures. So the kind of approach we have been having is to use the media where we get the opportunity, use the county governments, work in collaboration with county governments, work in collaborations with various stakeholders to be able to to push this message. But I think from where we sit at the National Cancer Institute, one of the areas that we want to take advantage of is those collaborations, like the one I talked about, using other government agencies, the Huduma centers, the provincial administration, so that now information percolates to all segments of society. So I think that it would probably, from where we sit, be more, would have a greater reach as compared to putting up, this adverts in localized areas, maybe in urban areas and so forth. So I think that's the approach that we are thinking about.
Thank you very much, Dr. Karagu. Thank you very much. It's good to know that the ministry is paying a lot of emphasis, or will be paying a lot of emphasis on cancer. And we will look forward to working with you. I think one of these days we will knock on your door and we will discuss what our plans are, what the ministry's plans are, and see if Rotary can sync with you and join hands with you and see where we can work together. Thank you very much.
We would be happy to have that conversation. Thank you very much.
Good afternoon. God bless you. Have a good day. My next speaker is none other than Dr. Sudesh Walia, who is also a passionate Rotarian. She's into alternate medicine. Welcome, Dr. Sudesh. What is Ayurveda and how is cancer involved with Ayurveda?
Ayurveda is more than 5,000 years old system of health from India. Can you hear me? Can you hear me?
Yes, we can hear you, Sudesh.
Okay. All right. In fact, you want to be able to hear me. Okay. As I was saying, it is a more than 5,000 old system of health from India. It would have been the leading system of health had it not been banned by British when they colonized India. So for more than 250 years it had gone underground, and now it is emerging. Now there are universities, colleges, even the Ministry of Alternative Medicine, even All India Institute of Alternative Medicine in New Delhi. So this is science of life, and it works on the root cause of any disease, plus on the physiological entities. It identifies each individual as unique. So each individual has different type of body type, that is prakriti or dosha, that is vata, that is air energy of the body, pitta, the fire energy of the body, and just in a simple way, otherwise there are lots of details, and kapha, that is the binding or the water energy of the body. Then there are dhatus, that is plasma, muscular tissues, fatty tissues, fat tissues, bone marrow, and shukra, that is reproductive secretions of the body. And then there is metabolic fire, that is that fire that controls the energy of body and controls the digestive system, etc. So in a nutshell, this is how Ayurveda works, identifying the basic body, its imbalances in the body, toxins in the body, and which part of the body is it targeting the toxins and the imbalances. And that is how we start our treatment.
Tell me, have you treated patients with cancer? What is your experience with
Generally, cancer patients come to us are those who have had surgery, who have had undergone chemo as well as radiation. And when they come very weak and completely depleted and they want to be rejuvenated, we detox them. And because Ayurveda is also a preventive system as well as rejuvenating. With our detox therapies, Panchakarma, that is the 5 actions, which is the basis of treatment of Ayurveda, they are highly rejuvenating. I can tell you about a very recent case. She is a Rotarian, and she has had cancer in 2010. Went for surgery, chemo, radiation. It came back in 2020 in January. She again went for surgery, but she was afraid of going for chemo because she had become very weak. She could hardly walk, she could hardly talk. She had been coughing, she could not sleep. So when she came to me, within 8 days, 2 hours at our place, through Panchakarma therapy, she was almost that healthy that when she came, she could hardly walk. And now she was able to take long walks. She was able to speak, she was able to sleep, cough was almost gone. There was another gentleman who was quite old, and he had gone through everything. And then when he came to us, he wanted to travel to Australia to his children, but he was too weak. So we rejuvenated through Panchakarma therapies, and he was able to travel, he was able to live with his children for about a year or so, and his quality of life improved considerably. So that is those who have already gone through modern science treatment. But I have this year recent a case, a lady who had breast cancer, which was identified as high grade. High grade means third or fourth stage of cancer, which is already grown and which was growing. But she was adamant, she did not want to go to the surgery, she did not want to be hospitalized. She did not want to leave her life. She wanted to stay as if nothing has happened. So we are treating her. We have about 6 months. What we have achieved for her is her low-grade fever, which she had been experiencing for years, is gone. Inflammation in her body is gone. There is no weakness at all, even for a day. While earlier, she used to feel some days that she could hardly climb a few steps, as if she had to drag her body. And from the clinical examination, I can say 50% of the tumor has shrunk. And maybe another 6 months, she continues, it should disintegrate and disappear. But it's a long process. But the thing is that we live with blood pressure, we live with diabetes, we live with heart problem. So one can live with cancer also without feeling the fear that the person is going to die. The person does not die because of diseases, they die because they have to die. That is the life cycle. And when God has given the life, that life, when it ends, even a healthy person dies.
Dr. Sudesh, congratulations on that. Your treatments are working. Tell me something comparatively
Kamal, I have not been able to hear you properly.
Compared to traditional method of treating cancer.
Second part I did not get. Traditional.
Is there any side effects?
Okay. Got it, Kamal. For modern science side effects, I will not comment on that because it is not my field. And for Ayurveda, it does not have side effects the way you may say that you take one medicine, it affects adversely the other organs. That side effect is not there. But one has to choose carefully the medicines, because the medicines that we use and the system of mode of treatment that we use, the steps that we use, they are according to each individual, according to, suppose a Vata person, air energy person, whose air energy is dominant, and we give some medicine, or he or she takes a medicine on her own, even if it is a herb from the kitchen, that if it accelerates the Vata, then the more disease will come. Ayurveda says there should be balance of the body, of doshas. So, no side effect that way, but yes, one should not take, even if there are things in the kitchen, simple herbs that we daily use, we should not overdo them. They should always consult their Ayurveda specialist.
Now, is Ayurveda applicable to all types of cancers?
Ayurveda does not target cancer of different types. Like I said, Ayurveda looks at the whole body as one entity. So, anything that has gone wrong, that means something is imbalanced in the body, there are toxins in the body, so we have to treat that, to bring the body in balance, remove the toxins, and then continue with some internal medicines, tablets, herbs, etc. So it does not matter. We have to be careful about it. How to identify the root cause of it. Ayurveda goes to the root cause. Ayurveda goes to the body itself, not one part or one disease. Kamal, you are muted.
How passionate, how you come to cancer,
What exactly your voice was breaking, Kamal?
Sudesh, what
Got it. I would say to all healthy and unhealthy persons who are facing some symptoms of any disease to be careful about their diet, to keep your body toxin free and keep your body balanced. How do you do it? Even a healthy person in Ayurveda should go for a detox, and they should be eating regularly. There should be a discipline in life in every day, in their sleep patterns, in their activities, in their thoughts, balancing. Ayurveda is a way of life. It is not just a system of treatment. It's not just treating a disease.
Thank you very much, Dr. Sudesh. We thank you for your passion. Thank you for joining us today. Thank you very much.
Thank you all. Thank you, Kamal.
Benda
Benda's here.
Good afternoon, Kamal. All of us. I would ask anyone who is not.
Hi, is Benda there?
Thank you.
Benda.
Sorry.
Hi,
I'm
Benda.
here.
How are you?
I'm here.
Good afternoon.
Hi, I'm very well.
How
Thank you. I'm well, thank you. Good afternoon.
Thank you. Thank you for looking very nice and smart for today's talk.
Thank you. It's the Rotarian way.
Yes, and it's nice to see you in pink, which is the color of cancer. Thank you so much for being in those colors. Benda, why are you so passionate about cervical cancer elimination?
Kamal, before I respond to the question, I would like to say that, yes, I am passionate about cervical cancer elimination, but because cancer is not one disease, and because you've mentioned that I'm dressed in pink for breast cancer awareness, I want to recognize that we're in the Breast Cancer Awareness Month. And so starting us off to this conversation, I want to draw the attention of all participants that every month there is a cancer that we can be talking about. So I'm hopeful this will not be the one and only talk that we'll have about cancers. Now to your point, why am I passionate about cervical cancer elimination? Kamal, when I came into this field for advocacy 9 years ago, I came with a personal story of discovering that some cancers can actually be beaten through communication and education. This is because at that point in time, 9 years ago, my sister was told she had cancer. It wasn't cancer. It was pre-cancer of the cervix. Now, when you hear the word cancer, even the word pre does not feature. We go into a panic, and that's what we did as a family. And we were thinking she was going to die. She didn't. She actually went on to recover, and she went on to become a mother of a second-born child. And that for me was an aha moment, because I realized our people are dying for lack of knowledge. Let me expound. Cervical cancer is one of the cancers that we know what causes it. It's the HPV, which is human papillomavirus. It's the one disease that we have technologies to prevent before it becomes a cancer. That's a vaccine. We also have the tools to prevent before it has become advanced cancer. That's through interventions, which we call secondary prevention of cervical cancer. It's also the one cancer that, if caught early, gives us a guarantee of 100% prevention, meaning the woman does not need to go through cancer if it is discovered early. And so because of that, I am passionate because cervical cancer has the tools for elimination, has the technology for elimination, gives us time. It takes up to 15 years in the body for HPV to change into cancerous cells. So if we catch it between the 1 to 8 years of infection of HPV and the cellular changes, the woman can actually be treated 100%, recover, and not have to lose a body organ. So for me, it is evident it's the one cancer that gives us time to prevent. And we can do so if we take concentrated action for it. Thank you.
Thank you, Benda. It's great to see your sister survive, and she's a mother of 2, and that's God's will. And we say a big thank you to the Almighty. Benda, tell me, why is the age limit for HPV vaccines so low?
Oh, wow. I'm glad you've asked that. So I mentioned the HPV vaccine is one of the tools that we use for elimination of cervical cancer. And I'll tell you, the age is 9 to 14 years. That's the WHO recommendation. And in Kenya, we are advocating for girls to be given the vaccine at the age of 10 years. And obviously, that's considered a low age for a vaccine. But the misconception is that it's low. Children are actually vaccinated from birth to 5 years old, and girls are given the HPV vaccine at the age of 10 in Kenya. Why then? Is because for us to effectively have the vaccine work in the body to build a preventative immunity, the HPV vaccine needs to be introduced in the body before the girl has been introduced to the virus itself. In Kenya, most of communities that girls are actually considered of marriageable age at the age of 12, which in essence, too young at that time. But if we get all communities to vaccinate their girls at the age of 10, we are that anything else happens before girls start being experimentative, before they start thinking of themselves as mature young girls, they have the vaccine, they can build their own immunity. That is one of the reasons. The other reason is, if we look at the epidemiology of...
And I'll just stop you there for a second. Tell me, I'm
yes.
diverting your answer a bit. You said that you try and you give the vaccines at the age of 12. So in Kenya, which
10.
communities do you target and go into that village or that area to target the vaccinations? Like what I'm referring to is it mainly concentrated on the Maasais or the Kalenjins or the Kikuyus or the Luos? Because getting married at the age is such a big taboo in this country for the villages.
Well, let me say this, Kamal, and I'm glad you've asked me that question. Let me say this. One of the highlights of my advocacy work is that we were able to introduce the vaccine last year, October, in the country through the routine immunization program. The HPV vaccine is available to every single Kenyan girl who is 10 years old. Any girl today who is 10 years old, turning 10 years tomorrow, or is 10 years, 3 months old, or up to and including when they are turning 11. So as long as they're 10 years old, in any community, in any village, or in any city, they can get the vaccine free of charge to them at no cost to the parents. It is available as a government program. And that for me is a highlight, because then it calls on us as communities to sensitize the people why it's necessary that they get the vaccine now, and why our girls can actually be, our 10-year-old girls can be the first cohort, the first age set that can actually eliminate the cervical cancer in the future if they're vaccinated today.
Congratulations on that great achievement, Benda. and I'm proud to say that you're a Rotarian, and it's a Rotarian who made that possible for those girls of 10 years old and getting a free vaccine in this country, where sometimes we don't even get free water, is a job well done. Thank you, Benda, for that. Benda, can you tell me, how do you see Rotary in Kenya?
Kamal,
Yes, go ahead. Benda,
okay. So I will say some here, and can you hear me? Can you hear me?
We can hear you now. We can hear you now.
Hello. The vaccine introduction by myself. I sat on the technical work group together with all the Ministry of Health teams and other technical teams that we work with, because it's team effort to bring the vaccine into the country. My role was in advocacy, and I'm a huge advocate for cervical cancer elimination in this country. Now, you've asked me, how can Rotarians join in? I want to first beat the drum for my club, Rotary Club of Karen. We have a global grant on cervical cancer elimination. And this grant is targeted at 4 counties where we're looking at being the voice so that we can be able to sensitize communities to bring the vaccine to the girls, to bring women screening so that we can prevent cervical cancer before it becomes a cancer. But secondly, as Rotarians, I love that as Rotary, we are people of action and we believe in service above self. And so as a community, we already have programming. We have community education. We have the 7 pillars, including environment. And tomorrow we'll be planting trees in Gong Hills. Rotary, we are people of action. The one thing that I would ask of Rotarians is, let's also piggyback our programs on what is already existing. If you're going to a community and talking about water and sanitation, talk about cancer prevention and cervical cancer. One thing to educate children, and then later they don't get the vaccine and they're dying of a disease that could have been vaccinated for. So advocacy, awareness, and education is one of the things that we can do very well as Rotarians. The second thing that I would want to point is we have ABCs of action. And this is assess where we are at. I can see my time is up, or are you giving me 5 more minutes? Assess where we are at, be bold in our programming, coordinate our efforts so that we're not duplicating each other. Let's declare action so that cervical cancer becomes yet something that we can do, and engage all our stakeholders so that we can work together as partners in prevention. Thank you.
Thank you, Benda. Thank you so much. I as a Rotarian, I've been in Rotary for a long time, but I've never been so proud by listening to you today and saying, yes, I'm a Rotarian. I've got friends in high places who are Rotarians and who are making a big, big, big difference, and that is what service above self. Congratulations to that, Benda. And now I'd like to introduce to you all to Cindy Ogana. Cindy, are you there?
Yes, I am.
Hi, Cindy. How are you?
Good. How are you?
Not so bad, Cindy. With those headphones on your head, it looked like as if you're a DJ, and I thought, oh, hold on, are we on a radio station or what? Welcome to Rotary Club of Nairobi Cancer Awareness Talk. Rotary District 9212 Cancer Awareness Talk. And you are a communication specialist, but fundraising specialist also with the Faraja. Tell me, what sort of support service does your cancer patients get undergoing treatment?
Thank you so much, Kamal. Before I begin, I just want to mention that as Faraja, we work with so many people on this panel. Thank you, Dr. Sudesh Walia, especially for the invite. Benda, we've worked very closely with you. Thank you. Modoni Mate, who's going to speak later on. Dr. Marek, who speaks at our forums, and of course, Dr. Alfred Karagu through our interaction at Kenko. So we're all one big family, and it's good to see familiar faces. So Faraja, what kind of support do we offer cancer patients? When somebody has been diagnosed with cancer, you can testify that, the number one emotion that they have is fear. They're like, am I going to make it? Is it going to deplete my resources? A lot of anxiety around that. Now, what we do at Faraja is we offer the psychosocial support that goes alongside treatment. When you sit in Dr. Marek's office and he diagnoses you with cancer, and he says you have stage 2 breast cancer, we have to do a mastectomy, and then you have to go through chemotherapy, radiotherapy, whatever the case might be. You're sitting there and you're thinking, as a woman, I'm going to lose my breast, I'm going to lose both my breasts, I'm going to be injected with this chemical, it's called chemotherapy, and then I'm going to be radiated, my hair is going to fall off, all those things that are happening. So Dr. Marek will sit down and give you the facts based on the pathological reports, but what we do is we take you after Dr. Marek, we sit you down and we allow you to go through cancer psychosocially. We program your mind so you can just see it as another step in the journey to your full recovery. We offer complementary therapies that research has shown, if they go alongside medical treatment, can give you a better prognosis, medical outcomes. So we're talking about things like nutrition, counseling, exercise, yoga, which is where Dr. Sudesh Walia comes in. Yes, she does volunteer her yoga classes. We have reflexology, massage, and all this is so that as you go through cancer, you do not forget who you are. You do not now call yourself a cancer patient. You are still Cindy, you're still Benda, you're still Anthony, Michael, Anne, Kamal. You do not now give yourself a registration number. You remember who you are, you remember the things you like, and we make you see it as just a bump in the road into your step of recovery. So we offer complementary therapies absolutely free of charge. We also have support groups because, you know, if, for example, when my dad was going through cancer, there were things he could not tell me. I'm one of his youngest daughters and he's a Luo man, so culturally, there are things he cannot tell me. But in his support group, he met men like him who demystified some of the things that he was feeling. Urine incontinence. This is a man who went about his business, was one time driving 2 cars, and now he cannot walk beyond a kilometer because of urine incontinence. And those are things that he couldn't share with me, but when he was a group of people his age would sit down and tell him, listen, you are still the one who calls the shots. But right now you have to admit that your body has taken a beating and you need to help it along the journey. Wear those adult diapers. And if you don't want to call them diapers, call them adult pants. Whatever the case might be. In the support group, he found people who he could work with. So we have 8 support groups so that the patients can have somebody to walk the journey with them. And guess what? The members of the support group are better counselors than our trained counselors, because our trained counselors know the textbook knowledge, but somebody who's gone there, eaten the fruit and knows how it tastes like, knows where it pinches, is able to tell you, don't worry, that's how it feels like, and so on and so forth. So we have complementary therapies, we have support group, we work with the children at Kenyatta National Hospital. Right now we are also at Moi Teaching and Referral Hospital, and we do what is called art and music therapy. Now, Kamal, I have 3 boys. My oldest is 10, my middle one is 2, and my youngest is 6 months. When my boys...
I was going to ask you to marry me.
I'm sorry, I'm taken. So when I talk to my boys, like my boy recently, and this is a true story, he had a very bad dream a couple of days ago and he was so scared to tell me. So I asked him to draw what he saw. And he drew, and through his drawing, I was able to understand, this is something that he saw probably from a video game, and that's the other. It's the same with children. Children are not able to articulate themselves the way I am, but they will play. Even when a child is sick, they will find a way to get some energy, to grab a ball, to skip around. So we tap into that innate energy of children and we introduce art therapy. We use art to demystify the cancer journey to children. Because when Dr. Marek is talking about, we had a pediatric oncologist, forgotten his name. When Dr. Marek, when the doctors, the oncologists are talking about technical terms, the parents are scared, the children are even more scared. They're being pricked all the time, chemotherapy, they're crying, they don't know what's going on. So we use art to demystify the journey, to teach them hope, to teach them resilience, to teach them love, and sometimes to teach them how to grieve. So we're at Moi Teaching and Referral Hospital every Wednesday and Friday. It's called Crafts for Cure, and we're very proud that this year, regardless of the pandemic, the Moi Crafts for Cure Monday to Friday at Kenyatta. But regardless of the pandemic, the Moi Teaching and Referral Hospital at Kenyatta have opened their doors for us and said, our children need support, especially now during the pandemic. Come draw, come color. And on top of that, every Friday, we donate 1 apple and 1 packet of milk. Why? Because when Faraja is there, everyone is equal. Everyone must be visited. Everyone must be given something special. There are children who've been abandoned, Kamal. Their parents said, you know what? This is urogi, mtu amerogwa. This is superstition. I don't know why your nose is growing bigger than your mouth. They abandon those kids. There's nobody to visit them. But when Faraja is there, everybody visits them. The final thing is we have a medical fund, and we realized it is all well and good for you to come to our center and get all these fantastic services for free. But if you're not able to pay for your treatment, then our support is not full circle. Cancer treatment minimum is 500,000. Even, Dr. Alfred Karagu can testify. NHIF comes in, but it pays 25%. And now it's becoming less and less. If you have cervical cancer, Benda can attest to this. After your chemo and radio, you need to do brachytherapy. Guess what? NHIF has said, if you have done radiotherapy, then it's the same amount of money for brachytherapy. You're not going to be supported twice. So we still have a gap in terms of financing, and that is where our medical fund comes in. And what we love about our medical fund is that it is our sustainability program, because we said, if I come to everybody here and I say, give me 1 million shillings, give me 1 million shillings, you will give out of the goodness of your heart because you're Rotarians. But the money will run out in 2 months. Cancer is expensive. The burden is high. So let's take all these monies, let's invest it. The equity from our investment is what we use to support patients. And our mantra is 50 patients every year forever. As long as the Faraja Medical Fund is there, 50 patients, you're guaranteed, 50 patients every year forever will get support, men, women, and children across the country, regardless of which hospital you're getting your treatment in. Terms and conditions apply. Treatment has to be within the borders of Kenya, and it has to be caught early. That is why it's very important to have talks like this so that we are aware of the risk factors and early signs. Don't come and knock at Faraja when the cancer has spread. When now Dr. Marek is telling you there's nothing much you can do, go to the hospice and get painkillers. We are here to tell you it is all right if you're diagnosed. It is not a death sentence. You can still live your full fabulous life. You will join our support groups. You will do our complementary therapies. If you have a child at Kenyatta, we will play with the child. We will give them an apple and a fruit. But most importantly, if you're in need, our fund will help you pay your chemotherapy, your radiotherapy, and your brachytherapy treatment. So that's the support that Faraja provides, Kamal.
Cindy, I don't know if I missed it out, but do you give psychological support to caregivers?
Absolutely. Caregivers are very important. All our complementary therapies are for the patient and the caregiver. If anybody in this panel, anybody in this Zoom meeting, and those watching via Facebook, if you've had a patient go through cancer treatment and you're a caregiver, you understand that the patient goes through it physically, but you go through it emotionally. This is somebody you love, you care about, and you see them emaciated. You see them, they are a pale shadow of their former self because of conditions like atrophy. You know, they increased protein in their bodies, causing their muscles to shrink. I don't want to talk the medical terms. That's why Dr. Marek is here. You see them lose their hair. Some, depending on the cancer they have, they can't even hold down a cup of water. Psychosocial support for caregivers is very important. That is why out of the 8 support groups Faraja has, 1 is for caregivers. That is why we have, when you come into Faraja, we ask you for your next of kin. You're coming for nutrition counseling, that's fine. Who cooks for you? Come with them. Let them also learn the nutrition counseling, but most importantly, let us counsel them so that they're not in the bathroom crying when you're getting treatment done and they're trying to be strong. And you know what happens when you have all this depression and anxiety and you're trying to be strong and you don't deal with, you're also putting yourself at risk of getting other non-communicable diseases. Mental health is real. And mental health can lead you to a decreased immunity, where now we're talking about being hypertensive and other things. So yes, we do support caregivers very, very much.
Cindy, lastly, just in 2 sentences, I want you to tell me, if today a parent would come to you and say, my child has got cancer, how would you treat them? Just in 2 sentences, I want you to tell me.
Number 1, we tell them it's okay. it's okay, your child is going to make it. Number two, we would enroll both the child and the parent into our therapies. With the parent, of course, there is counseling that has to be done. And it's not only the parent, but we also do family counseling, because we have issues where family members struggle to break the news to their loved ones. So we have family counseling for the parent. For the child, we'll sit down with the child. We have child care specialists. These are trained people who are trained in the art of child life and art therapy for children. And they will sit with the child and they will demystify this journey of treatment for the child through the process of art therapy. So whatever techniques that they've learned, if it's crayons, if it's Play-Doh, they're not just coloring. Like, I don't know if you can see this fantastic portrait behind there. You know, it's not just about lovely butterfly looking things. It is about, as you color, how do you feel? What is the color of your feeling? Draw for me despair. Draw for me hope. When you see the nurse coming with that needle to put chemotherapy, how do you feel? Let's rebrand this needle. Let's not call it radiotherapy. Let's call it going into the spaceship. You know, playing with the child so that the child can understand what you're going through.
Thank you very much, Cindy, for your wonderful explanation points. And for me, I think I'm talking on behalf of Rotary District 9212. You are our Mashuja, Faraja is our Shuja, and my hats off, and I salute you for this. And, you've touched me at the heart. I've lost a very good friend to cancer. She's like a sister to me, and you've made me thought of her today. And God bless you guys, and it's great working with you at Rotary. Thank you very much, Cindy.
Thank you so much, Kamal, and I'm sorry for your loss. Come to us for counseling.
No, I'll come to you, not for counseling. Have a great day, and thank you very much. Now, my next speaker is going to be Charity. Charity, are you there? Charity. Is Charity Wairumu, how are you? I'm good. How about you? I can't hear you, Charity. I'm good. Anthony, yeah. Charity, hi. Hi, can you hear me? It's very low. Can you speak louder? Yes. Hi, can you hear me now? No bit louder. Hi. I wouldn't mind if you shout at me today. Hi, can you hear me now? Yes, now that's better. Yes. See, if I say people to shout at me, they love talking to me. Cindy, welcome to our District 9212 Cancer Awareness Talk for Rotary. Please share with us your narrative and the psychological and social dilemma you faced as a consequence as a cancer survivor.
So my name is Charity. I am a cancer stage 4 survivor, Hodgkin lymphoma. And I was diagnosed in 2001. And about my social effect, it was very kind of scary because all my family members, they ran away. They said I won't survive because it was at the last stage. So it was a bit scary for me. And I couldn't believe because, you know, being at the age of 9 and you're suffering from cancer, it's kind of traumatizing. So it was very frustrating for me. Yeah.
So let me go back into the year 2001. What symptoms did you see, or what made you go to the doctor? Let's start from there.
Okay, it all started in 2000 when I was feeling nausea. I was vomiting a lot, and then I lost my weight. So when I went to hospital, they could detect that I had malaria and typhoid, but they were treating a wrong thing. They were treating a wrong disease. So when it came to 2002, it's when I got into a coma. I got very serious and very sick. So I went to Kenyatta National Hospital, and that is when they decided to do biopsy. And they noticed also some problem with my lungs. So when they did biopsy, the node was at my neck. So when they did biopsy, they saw it was Hodgkin lymphoma stage 4. So they had to do everything possible for me to undergo a surgery. And then afterwards, I went through chemotherapy for 5 years, from 2003 to 2007. And then from 2008 to 2013 is when I was going for checkups. And around 2013, October 10th, that's when they say that I was cancer-free. They were not seeing any symptoms of cancer anymore. Yeah.
And so I'll now just rewind a bit, not too much. You've been to the hospital, you've had the surgery, they've done a biopsy, and who gave you the support thereafter? Because you said your family ran away from you. So who was there to support you?
I would say my mom was the only person who was there to support me, but I never had any psychological, maybe a mentor who could mentor me psychologically, but my mom was there for me as a parent.
And we say a big thank you to her for standing by you. Is she with you today? Is she listening with you today?
Apparently, she's not at me right now. She's not with me right now, but I believe where she is at work, she is.
And I hope she's listening, and we say a big gratitude to her from Rotary.
Yeah.
Charity, now coming back, you are diagnosed cancer-free. So what are you doing to remain cancer-free? Do you have a life change, a dietary change? What have you done?
Okay, I would say cancer is a marathon, not a sprint. So I usually do some exercises. I watch on my diet, and also I try to keep myself out of stress. Yeah, so basically it is a matter of taking responsibility about my life, because some of these diseases, they tend to come back, but I am taking good care of my health.
So did you say you stay away from stress?
Yes.
Okay, then I need to sit down with you and learn how to stay away from stress, because that's one thing doesn't leave me. But no, it's nice to hear that. Before we sign off, you said that, again, I'm going to repeat this. You said your relatives and the people surrounding you ran away. What was their reaction when you told them you are now cancer-free?
Okay, first of all, I would say the doctors, they were so shocked, because they had said I will stay in medication the rest of my life. And also my family, they were so shocked, and they were saying they can't even believe it, that I could survive from cancer stage 4, because it is a rare case for someone to survive. So it was a shock news for them, but they had to adapt.
And your full chemotherapy and your full surgical care and your radiotherapy, I think that's what you said also, was all at Kenyatta National Hospital. Am I right?
Yes, it was at Kenyatta National Hospital.
Well, congratulations, Charity, for being cancer-free. And it's great to know you are a cancer warrior. You are one of many. And you are an inspiration to many. And we're great to host you today at this talk. And again, I salute you for your resilience. And I think that's what has brought you to the stage where you are, your resilience. You fought that cancer cell, and you said, don't come into my house and I will kick you out. And with that, you are my shuja, Charity. I respect you, and God bless you.
God bless you too, Kamal. Okay.
My next cancer survivor or cancer warrior is none other than Carol Muthoni. Carol, are you there?
Yes, I'm here.
Carol, I want to see you. I don't talk to people whose face I don't see. Even my wife.
Okay, 1 second, just give me a few seconds. There I am.
It's okay. I like your car. Don't worry. You, even my wife.
I've had to first.
Even my wife, I did not say yes to her till I saw her face. So it's nice to see you, Carol.
Yes.
Welcome to our Rotary Cancer Awareness Talk, hosted by the Rotary District 9212.
Yes.
Tell me, has your perspective towards your life changed?
Before, yes, it has, because I can say before I got my cancer diagnosis, I used to live a life where you take a lot of things for granted. You take waking up in the morning for granted. You take the energy levels for granted that you'll always be there. So you plan having the assumption that you're guaranteed to be alive tomorrow. But after the diagnosis, what has happened is that I have learned how to appreciate that every single day is not guaranteed, and the best that you can do is make the maximum out of it.
So when you get out of bed, do you plan your things? Do you plan your day differently from yesterday, or is it now after your survival? Does it become monotonous? How are you doing things differently?
So my planning now is more of I still do the long-term planning for the future, with the hope that I'm going to see it, but every single day is an actualization day towards the dream and aspirations that I have. So yes, it's just planning for long term, but actualizing it each and every day to just make sure you get the maximum out of each day.
I read from your CV, you're working within the East African region. So I'm presuming you travel a lot. Has that hindered your working? Your cancer, has it hindered in you working, or have you had to change jobs? Tell me more about it.
What has happened, just allow me to switch off the video because of my internet is a bit slow. Yeah. So what has happened is I've managed to at least, I was lucky enough to be in a work environment that was accommodating me even when I was on treatment, and would allow me to either work from home and stagger out so that I didn't have to be working for long at a time. And even this happened even when it helped me with, like, currently even where I am right now, at least being able to again have a platform that allows me to go for my reviews, do my appointments, and just continue with my treatment, even as I do my day-to-day work.
So you're still on treatment, are you?
Maintenance treatment. I'm on the 5-year tamoxifen.
Okay. And,
yes.
And tell me, how has it been with you in terms of your family support?
Oh, my family support has been amazing. From day one, they really rallied around me to just make sure that I had what I needed, whether it was in regards to psychosocial support, financial support, somebody being there to make sure that my daughter is taken care of. She never had to see me on really bad side effect days. And
sorry,
just basically,
Mudhani, we lost you there. Carol?
There. And this, when I say family, this encompassed plus members.
Excellent. You mentioned your children, your daughter. How has she taken it?
Including my immediate family member.
Mudhani, hello? Can you hear me, Mudhani?
Oh, sorry.
Hello, Mudhoni. Have we lost her? Anthony, have we lost her? I think we've lost Mudhoni. We'll try and get her back online and finish off and see if she can join us again and finish off our questions. While we're doing that, I will welcome our own Rotarian, Joyce Shamshuddin, who's also been a cancer warrior and a survivor. Joyce, welcome to the Rotary Awareness, Cancer Awareness Talk. Joyce?
Yes, thank you. Thank you, Kamal. Can you hear me?
Yes, I can hear you, Joyce.
Well, we're going to do the presentation of my slides, or do you want me to just go ahead with my...
Yeah, let us get
Anthony,
your slides.
Anthony had the slides.
So, Anthony, can you share the screen, please? Anthony? Okay. Thank you, my friend. Thank you so much.
Okay, good afternoon, Chair Lady, President, Rotarians present, and guest. My question was the financial implications of cancer treatment locally and abroad.
Joyce, please unmute yourself.
Sorry. Okay, good afternoon, everybody.
Good afternoon, Joyce.
Can you hear me?
Yes, we can hear you, Joyce, now.
Okay. I'll introduce myself. I am a breast cancer survivor. Anthony, can you move the slides down for me, please? The next slide, please. Thank you. Second slide, please. Okay, I'm a breast cancer survivor who received treatment in Kenya at the Aga Khan Hospital, Nairobi. I was diagnosed with the triple positive breast cancer on my left breast in October 2016. This was the beginning of my cancer journey. My treatment plan included total unilateral mastectomy, 6 cycles of FT chemotherapy, 18 cycles of Herceptin and Hetras, and a 5-year of letrozole, which I'm in my 4th year of treatment. The next slide, please. The cost implications at a private hospital. As you can see, my total cost came to about 5.6 million, but because I have the triple positive, the most expensive treatment at that time was the targeted therapy, which is the Herceptin. It's one of the expensive treatments, and you have 18 sessions. Chemotherapy was 360,000. Surgery stay at the hospital was 600,000. Hormone therapy, which is still ongoing, and that is not paid by, it's paid by me, is about 870,000. Diagnosis initially about 20,000. Ongoing reviews every year, total with lab tests, vitamin injections, things like this, it comes to about 50,000. I'm happy to say all this was really covered by NHIF and my 2 private insurances. The family had to pay just what is the ongoing medications that I take currently. And medicines in Kenya are very expensive. So I really actually found a source where I can get my medicines, which I continue taking daily for the next year. It was on a 5-year course. I bring it in from India, so it saves a lot of money. But if realistically, if it was bought in Kenya, that was the amount of money I would be spending. Next slide, please. Comparative to prices in a private hospital in Mumbai. The costs above are based on my husband's treatment for papillary thyroid carcinoma. He did not require any chemotherapy or radiotherapy. Hence, I'm not able to compare the cost in Kenya and India. But these costs were covered also by private insurance. As you can see, it was close to 1.8 million. And this included the flights, hotels, and his hospitalization surgery. So compared to breast treatment in Kenya and in India, there is a difference in cost, but I would think if you add all the non-medical costs like the accommodation for the king, for the family who accompanies you, the time you spend there, it all adds up. And eventually, I think it's not much of a difference with the Kenyan situation. If you go to hospitals that can treat you at a cheaper rate. I went to the Aga Khan hospital because that was what my insurance was. Otherwise, if I'd gone to another hospital, maybe it would have been cheaper than the monies I've spent. I also used the original Herceptin, which is very expensive, but later changed to Hertraz, which is a generic, which then lowered the cost. But if I'd gone right through with Herceptin, it would have been much higher. So comparatively, I can say either way, you can do surgery, and your main surgery can be done overseas in India, but the rest of your chemotherapies and all can be done in Kenya, because staying 6 months in India is an expense on its own. So but maybe surgery would be cheaper there. Can I have the next slide, please? Tony? Yeah. Tony, please go back. So the cost implications following a cancer treatment, insurance premiums go up, and some even refuse to take us on. Time off work or early retirement, health deterioration due to the chemotherapy, more medications are required. Sorry, I can't see what's there. More medications required for regular health due to side effects of cancer therapy. For example, I'm now on calcium and vitamin D supplements due to reduced bone density from letrozole. Psychological effects, anxiety of whether the cancer will return. I also seem to be coming from a family full of cancer. I had a brother who I lost 2 years ago to lung cancer. My husband was diagnosed with thyroid cancer late last year. My sister, older to me, was diagnosed with breast cancer November last year. She did a total, complete bilateral mastectomy early this month. My younger sister was also diagnosed with breast cancer. She also did a total bilateral mastectomy also early this month. Hers was very early, so she was lucky. But the older sister, she had to go through chemotherapy. She's undergoing radiation, and she's also going through Herceptin treatment. I keep telling everybody, you have cancer, get it diagnosed early, because if it's diagnosed early, it can be treated. And most of all, and most important with cancer patients, I say, please be positive. It is not the end of the world. It is just another condition in your body. If your mind is strong, and if you can handle, and if you're positive, you will be able to get rid of the cancer, probably survive most of the side effects of chemotherapy. I was surprised from what I read, and what I went through for my chemotherapy was totally different. But I guess, as Dr. Marek said, everyone has a different reaction to chemotherapy. I'm happy to say I had no major side effects with chemotherapy, except the hair loss, which of course every woman would hate. But other than that, the vomiting, the sickness, the low immunity, I was so happy. I just kept my mind strong and I knew I had to overcome this. That's, I think that's all I have. Is there any questions?
Joyce, we are all with you, hand in hand, and despite of what you've been through, you were also president, I think, when you got diagnosed with cancer, or you were suffering from cancer, and you also took on the mentorship at your Rotary Club, and you did a great job there. This shows that when you are a cancer patient and a survivor, your life must continue, and you must do what you're doing all the time. Joyce, one question that comes to me is, I've seen you've traveled, for your husband, you traveled overseas to get the treatment done. You had your treatment done here. Is it better to have a treatment done in your home country, or do you suggest to travel? In terms of family support, mental support, what do you suggest?
Yes, I would strongly recommend you do treatment at home, because here you got all the support you have. You are in your home. You come home from your treatment. You have family around you. You have all the support you need. And when we had gone to India with my husband, it was tough. It was tough for me and it was tough for him, because from hospital treatment, you come back to a hotel room, there is no friendly face that you know, there is no comfort you get. It's hard. And I feel sorry for people who have to go overseas for their surgery because it just doesn't feel home. I would strongly recommend, if you can afford to have your treatment done at home, do it at home. Keep your NHIF, make sure you have your NHIFs up to date. Make sure you have insurance, a medical insurance, 1, 2, whatever you can. But it really matters whether you are healthy or not. Have a medical insurance in place at all times. It helps. You never know when you'll be hit by anything. Keep yourself insured as much as possible.
Thank you, Joyce. Lastly, I met you a couple of weeks ago, and you were with your full family there, and it was great to see your family together with you. I think that's very important, isn't it? Family to be together as a nuclear connection.
Yes, Kamal, family is the most important thing to have around you. If you don't have family support, then you're psychologically weak. So all these add up. If you're psychologically weak, you don't have support, you don't have family around you, obviously the cancer will take over your body. So it makes a difference to have family with you at all times. It's a good support system.
Joyce, this is something I wanted to ask the doctors, but it slipped my mind. But I'm sure you've looked into the pandemic that we're going through currently. It's saying that the old-aged, the diabetics, the blood pressure patients, including cancer patients, need to be very, very careful. What have the doctors advised you to do to stay away from this pandemic?
You have to keep away from crowds, keep your masks on, avoid any unnecessary outings. I know you saw me in Mombasa, yes, but it was strictly just family together. Keep away from things that can expose you to the COVID. But you don't have to be so restricted, really. Relax, enjoy things around you. There are so many, we've learned to live within enclosed areas since we've had the COVID, and make the most of it, I would say. Don't overdo things.
Thank you so much, Joyce. Thanks for your experience and sharing with us what you've been through. and including that of your husband. Well, going back in a couple of years ago, nobody would share with anybody what you've shared with us today, because at that time cancer was a life-threatening disease. If somebody was to tell you you've got cancer, as I said, you would feel that the world has come to an end. But now we have a lot of technology, a lot of medication, we've got a lot of history, and new technologies and medication is coming out every single day for cancer. 5 years ago, we didn't even have a cancer hospital or ward in any of the hospitals. But now we have that. So it's thank you for sharing your experience with us. Now I'll go to our Q&A. Anthony, okay, I've got the chat. I've gone through the chat. There was only one question, which was from Grace Wambui. And she said that she has a 4-year-old son who has been diagnosed with early nephroblastoma, stage 1. And she wanted to know if Faraja can help. Cindy has been kind enough to respond to that. And I think Grace has taken note of that. So thank you very much, Cindy, for your quick response on that. Also to Keith Castellino, thank you very much, Keith. It's nice to hear from you. Keith was in Rotary Club of Nairobi East, but is now in Germany. He's with in the same, I think, district as our Rotary International President. Thank you very much, Keith, for logging on today. Then we have the sister of our late member, Marie Nelson. That's Kerry Nelson. She's giving a word of support to everybody, and she's also said if people need to get in touch with her, she can give us support as well. If there are any questions, we have Veronica Ojiambo with us. Veronica, can I give you 2 minutes to talk about prostate cancer? You're doing some theses on prostate cancer. Veronica, are you online?
Hi, yes, I'm online, thank you.
Hi, Veronica. Again, I don't see pictures. I don't see your beautiful face. And I'm presuming you're a mirror image of your mom.
I really am, thank you. I'm sorry, you're going to have to forgive me. It's a bit busy in the background here.
No problem at all. Give us your 2-minute talk on prostate cancer.
Yes, as was mentioned earlier by some of the speakers, I think with prostate cancer, it will be important to get the messaging out there to men and kind of promote a culture in Kenya that allows men to be more health aware and practice more health-seeking behaviors around prostate cancer. And yes, I'm in research and I'm continuing to learn more about what's happening in the Kenyan field, and I'd be glad to continue to grow the research in Kenya on that. Thank you.
It's back to you, Kamal.
DS Kamal, where are you?
Kamal,
Okay.
you're muted.
He's not there.
Hello, Veronica.
Hello?
Are you there?
Yes, I am, yes.
So thank you very much for that, Veronica. Tell me, whereabouts are you doing your thesis?
I finished my research in Bristol. I was in the University of the West of England in Bristol, and I'm just now back home, about a week now in Kenya.
Okay, and do you intend to practice here?
Yes, I do intend to practice. My special areas are health communications and non-communicable disease, with cancer being my specific interest area.
Okay. So I hope we can as Rotary, we can work with you and see how we can tap onto your expertise and on your thesis and see how we can expand cancer awareness in Kenya.
Yeah, that would be lovely. Thank you very much. And thank you for inviting me today to your talk.
No, it was a pleasure having you. And please tell your mom that we're going to find her because we couldn't see you.
I will.
So once the pandemic is over, I think she owes all of us in today's session a cup of coffee.
Thank you so much. Thank you.
So much. I will now hand you over to our chair, that's Rotarian Anne Mandove, to give the way forward. Dr. Anne.
Oh, thank you very much, JS Kamal. I think before you hand over to me, is it possible to do the roll call?
I'm just going to talk to Anthony and I'm going to do that in a short while.
Oh, okay, so dear Rotarians, before I round up, I would like you all to have something to drink because we are going to toast to our team, to the warriors, to our doctors. So just make sure you have something, coffee, tea, wine, whatever you're drinking, have a glass ready, please, yeah.
Dr. Anne, while they're having their cup of coffee, can we toast to the members, sorry, the clubs present, please, if that's okay in order? Mr. President, is
okay,
that
we can toast, then we still toast again, no problem, yes, okay.
Mr. President, that's okay. So with that, I give you to Rotary Club of Nairobi, Rotary Club of Nairobi East, Rotary Club of Nairobi Hurlingham, Rotary Club of Karen, Rotary Club of Karura, Rotary Club of Thika Road, Rotary Club of Embu, Rotary Club of Lavington Gioni, Rotary Club of Nairobi Utumishi, Rotary Club of Machakos, Rotary Club of Ongata Rongai, Rotary Club of USIU, Rotary Club of Gigiri, Rotary Club of Limuru, and to the Club of Keith Castellino. I think it's Rotary Club of, can I unmute Keith? Keith, are you there, please?
Kamal, it's the Rotary Club of Bonn International.
Yes, Bonn International.
In Germany.
Thank you very much, Keith, and nice talking to you. We'll talk later on, my friend, more.
Cheers, Kiki.
And Rotary Club of Milimani.
Rotary Club of Milimani, Rotary Club of Bonn International, and my special acknowledgement to the Faraja Cancer Trust, MP Shah Hospital, and to the whole of District 9212 Cancer Awareness Committee, to the Rotary the world over.
Rotary the world over.
Rotary the world over.
Okay, now I just have a short comment. Today has been a day of great learning. Most of us have to face this disease, dreadful disease, either personally or as we witness it through our near and dear ones. I am privileged to have the opportunity to organize this event to educate the public. I wish to wholeheartedly thank the panelists, each of whom are honored to have been on this program. And to my Rotary District 9212 Cancer Awareness Committee, as we now look forward to our gala dinner immediately after this COVID. I thank all on behalf of our district governor, Patrick Obat. So I want, wherever you are, before we give the floor to past President Salim to give the vote of thanks, but I want, wherever you are, to be upstanding a bit, wherever you are, sitting. Yeah, we want to, first of all, I like to acknowledge the presence of Dr. B.M. Gikoyo of CEO of Karen Hospital. I would like us to spend 1 minute to just remember those our loved ones who have passed on through this dreadful disease. So let's be upstanding for just a minute. And may their beautiful souls rest in perfect peace. Amen. I will now hand over to past President Salim. And before then, let me say special thank you to our former district secretary, Kamal, and he's part of our cancer team. Thank you very much. I don't want to take this for granted. Thank you for coming through for us as usual. Thank you, PP Joyce, Dr. Sudesh, all the doctors from Faraja. I thank you, and most especially from the United States, the Carrie, the sister of late Mary Nelson. Thank you for being here with us. We appreciate. Thank you. So I hand you over to past President Salim Fazal to give the vote of thanks.
Thank you, our Chair Lady Anne, on behalf of the team of District 9212 Cancer Awareness Team. I take this opportunity to thank you all those who have attended and all the clubs. The names have already been mentioned by past President Kamal. I also take this opportunity to thank all the doctors, all the consultants, all the cancer survivors. It has indeed been a great experience listening to you, and I'm sure we all have learned something from you, and I would like to greatly appreciate for you having spared your time coming here and making this occasion a success. And I hope that, like Anne has mentioned, that hopefully once this pandemic is over, we would like to have the annual dinner where we hope to honor you, all those who have given your time to come here. Thank you so much and have a good day. Thanks.
Thank you very much, PP Salim. President Ritesh, thank you. Do you have anything to say? We can just see the chat. The section is closed now.
Thank you, Dr. Anne. I wish to congratulate you, and I wish to congratulate all the panelists and thank them for taking the time out to give us this vital information. It's been very informative. And I'm just hoping that all the participants and all the attendees can share this information widely. And this cancer awareness initiative, which you are championing on behalf of the district, I'm very glad to see that there is an ongoing program, and the next event is going to be the Cancer Awareness Dinner, which is going to be a fundraising dinner. Basically just congratulations, and very well moderated by past District Secretary Kamal Sanghani. Thank you.
Thank you, President Ritesh. I think we can all live at our own leisure. So if you want us